Good morning, viewers. Today we are going to discuss ribs. So we all know we have 12 pair of ribs, right? So we have true ribs as well as false ribs. So true ribs, first 7 are true ribs, 8, 9, 10, 11 and 12 they are false ribs. So how we differentiate true from false ribs is by their articulation. So we have two ends of the ribs, anterior and posterior end. If the anterior end we know articulates with the sternum, right? And the posterior ends articulate with the vertebra, right? So vertebro-sternal ribs, right? Vertebro-sternal ribs, they are called as true ribs, and that are first 7 ribs are true ribs that are vertebrochondral. It means posterior end articulates with the vertebra and anterior end with the sternum. So vertebro-sternal ribs are the true ribs. Now coming on to the false ribs, 8, 9, 10. 8, 9, 10th ribs, what happen in them is the 8th vertebra, like this is the 8th rib, it articulates with the cartilage, costal cartilage of one higher rib. Similarly 9th comes and articulate with the cartilage of this 7th vertebra, and 10th, 8th, 9th, 10th combinedly they join to articulate with the cartilage of the 7th, and then finally joins the sternum. So they are vertebrochondral ribs. So they are not articulating directly with the sternum, they are articulating with the costal cartilage of the 7th rib. So they are vertebrochondral, chondral for cartilage, they are vertebrochondral ribs, right? And last two, 11th and 12th, they are the floating ribs. So floating ribs means floating, they are floating, means anterior end is free and the posterior end articulates with the vertebra and anterior end is free. So it is only vertebral rib, right? So no, first true ribs, first 7 they are vertebro-sternal ribs, 8, 9, 10 they are vertebrochondral ribs, and 11 and 12 they are the vertebral ribs, right? Now coming on to the detailed features, and it has anterior and posterior end, right? So this I have hold at atypical rib. First 2 and last 3 they are atypical ribs, and 3 to 9 are typical ribs, right? So this I am holding the first rib. So it is flattened, you see. So it has upper and lower surfaces, anterior and posterior border. This is typical rib. So it is not flattened. It has upper and lower borders, anterior and posterior surfaces, right? Outer and inner surfaces, right? And upper and lower, superior and inferior borders, right? So flattened surface obviously have upper and lower surfaces, anterior and posterior, outer and inner borders, right? Similarly, we have typical ribs which has outer and inner surfaces, and borders are outer and inner surfaces, upper and lower borders, right? Now, two things are already done, and anterior and posterior end. So how to differentiate? Anterior end has a concave margin for costal cartilage and finally articulates with the sternum. Anterior end finished. Posterior end, how we differentiate from anterior? It has head, neck and tubercle, right? Head, neck and tubercle. So posterior end articulates with the vertebra. Now I will show you how they articulate with the vertebra. So we have head has two facets, two facets, upper and lower facets, and one ridge separating the facets, right? So similarly on the vertebral body we have two facets, 1, 2. How to articulate? The lower facet of the vertebra articulate with the corresponding vertebra upper facet, superior facet of the corresponding vertebra. So if we articulate the lower facet of the rib, if it is 6th vertebra, this is 6th rib and this is 6th vertebra, the lower facet of the 6th rib articulates with the upper of the corresponding means 6th thoracic vertebra. Automatically if lower articulates with the corresponding, then upper will articulate with the facet of the upper vertebra, one higher level vertebra, right? Similarly we have a neck, and then we have a tubercle. Tubercle also has a facet on the medial side, and lateral is non-articular. Facet has a medial and lateral parts, medial one is articular part. So if I articulate the lower facet onto the upper superior articulating facet of the corresponding vertebra, and the upper facet of the rib with the head with the lower facet of the one upper vertebra, then automatically the neck articulates with the facet on the transverse process as well as the medial surface of this tubercle. Medial surface of that facet on tubercle articulates with the facet on the transverse process. This is a transverse process, right? So this is how it articulates with the vertebrae, right? So So this articulate with this, anterior and posterior and finished. So we have upper, superior and inferior border, we have outer and inner surfaces, right? Now, how to differentiate? If I hold it like this, I can also hold it anterior, posterior, anterior, posterior. Now, one thing you have to look is, inferior surface has one groove. Groove lies near the inferior border, not towards the superior. If I hold it like this, the groove comes towards the superior surface. So this is wrong. This is not of right side. So if I hold it like this, anterior, posterior and upper and lower, and groove on near the lower border, right? So this is right. So this is of left side, right? Now, let's coming on to the detail of parts. Anterior and posterior and I finished. Superior and inferior surface I finished. Then groove near the inferior border I finished. Then we have a sharp bend that is called posterior angle. Similarly, we have anterior angle. Anterior angle is not that marked as compared to the posterior angle, right? So now coming on to the attachments. Attachment I will discuss near to the head we have radiate ligament and lateral coronal ligaments, right? So now coming on to the attachments on the lateral 1/3 of this, right? So we have two muscles. Upper border is thick and inner is thin, right? Sharp, and near the lower border we have a groove, right? Upper is broad and has two lips. I will show you on this. This is more prominent. So upper is sharp, it has outer and inner lips, right? So outer lip gives, now I am telling you the insertion of two muscles on the outer and inner lips. Outer lips, external oblique muscle, and that too insertion. Inner lip, external oblique, inner lip is internal oblique. External and internal lip gives origin to the, insertion to the external oblique aponeurosis and internal oblique aponeurosis. Similarly, on the lower border, we have external oblique aponeurosis. Here we have insertion, here we have origin, right? Then we have groove, where lies the origin of the intercostal muscle, innermost intercostal muscle, right? Innermost intercostal muscle. Then immediately above the groove we have a ridge where lies intercostalis intima muscle, right? And that is origin. Then near the superior border or near to the inner lip, there is insertion of the intercostalis intima muscle, right? This we have finished. Now coming on to the posterior angle, where lies the posterior layer of the thoracolumbar fascia. Behind this posterior angle, we have two muscles, iliocostal and levator costi, right? Iliocostalis and levator costi, right? So near to the anterior angle, we have three muscles. One is serratus anterior of first eight, lower eight ribs, upper eight ribs, right? Then lower eight ribs, upper eight ribs have serratus anterior. Then lower eight ribs have external intercostal, external oblique muscle origin. And then we have, these are the origins of three muscles. Serratus anterior, behind the anterior angle. First is serratus anterior, second is external oblique origin, and the third muscle is origin of latissimus dorsi, right? And that is from the lower three ribs, 3 or 4 ribs. Lower 3 or 4 ribs gives origin to the latissimus dorsi and insertion to the serratus posterior inferior muscles, right? I will repeat. Near the anterior angle, the first muscle, upper 8 ribs gives origin to the serratus anterior, and lower 8 ribs gives origin to the external oblique aponeurosis, right? And then last 3 or 4 ribs gives origin to the latissimus dorsi and insertion to the serratus posterior inferior muscles. Okay, thank you very much.